Hey, so we're back again with the answer to question number 10. All right, so the question was the other day, a nurse has just received report on 4 clients. Which client should the nurse assess first? A client with chronic COPD whose oxygen saturation is 90% while receiving 2 liters per minute via nasal cannula. B, a client who is 2 hours post-op and has bright red blood saturating the surgical dressing. C, a client requesting pain medication and rating their pain 9 out of 10. Or D, a client scheduled for discharge who has questions about their medications. So the correct answer was B. The client who is 2 hours post-op with bright red bleeding or bright red blood saturating the surgical dressing. Let's get right into the rationale. This client has active post-operative bleeding, which is an unexpected finding and can rapidly become life-threatening. Bright red blood indicates fresh, active bleeding. If not addressed immediately, the client is at risk for things like hemorrhage, hypovolemic shock, decreased tissue perfusion, hemodynamic instability. Using the ABCs, airway, breathing, circulation, and the unstable versus stable priority framework, this client requires immediate assessment and intervention. The nurse should promptly assess the surgical site, reinforce the dressing if appropriate per facility policy, monitor vital signs, assess for signs of shock, and notify the surgeon or healthcare provider while following facility protocols. Now, I'm going to give you an NCLEX memory trick for today. Bright red blood. Think active bleeding. When you see bright red blood, saturated dressing, fresh postoperative drainage, think immediately. Circulation problem equals assess now. Don't wait. Assess now. Okay, then we're going to get right over to the NCLEX prioritization tip for today. Ask yourself these questions. Who is unstable? Who has an unexpected finding? Who is at the greatest risk of deteriorating? Who could die first if I wait? The answer to those questions often points you to the correct NCLEX choice. Now, today I'm going to also give you a little NCLEX nugget. When prioritization questions involve postoperative clients, be alert for complications such as excessive bleeding, respiratory distress, signs of infection, changes in level of consciousness, severe hypotension, and uncontrolled pain with other concerning symptoms. Unexpected postoperative findings almost always take priority over routine or chronic conditions. All right, so we've gone over everything today. So the correct answer again was B, the post-operative client with bright red blood saturating the dressing. Remember, fresh, bright red blood after surgery is an unexpected finding and may indicate hemorrhage. NCLEX tip, always prioritize the client with the greatest risk of immediate deterioration. Did you get it right? Drop a heart emoji for yes. Drop a couple of books if you're still learning. Tell us what helped you choose your answer. And remember to follow Concierge Star Nursing Academy for daily NCLEX questions, answer breakdowns, and test taking strategies that help you think like a nurse. Study smart, think like a nurse, and again, you will pass like a pro.